afternoon, everyone. So now that we're all well fed, I'm sure we're ready for a good conversation on health financing. I'd like to call up our panelists for today. First up, I would like to call Dr. Uchenna Ibokwe, Chief Executive Officer of Solina Center. Thank you. I'll also like to call up Dr. Amina Aminu Dorayi, Senior Country Director, Pathfinder International. We also have Dr. Charles Olusegun Doherty, General Manager of the Ekiti State Health Insurance Scheme. And I believe virtually we should have Dr. Biobele Davidson. Virtually? Okay, she's here in person. That's great. Love that. Thank you for coming this way. Thank you very much. So we're really at a critical moment for the future of Nigeria's health system. Some of you may know that just yesterday, the National Health Financing Dialogue Report was published, and it noted a few key things. It noted that there was rising domestic responsibility, declining donor flows, urgent need for new accountability systems that ensure impact at every level of government and society, and some key numbers. Over 70% of health spending in Nigeria is still out of pocket, which is a big cost to families. Insurance coverage remains at only 10%, even with the pressures of our population growth. But in the report, it also highlighted the fact that there's immense political will to shift Nigeria from dependency to self-sufficiency. There's a lot of federal alignment on mandatory health insurance. There have been calls to expand BHCPF from 1% to 2% of our consolidated revenue fund, increasing private sector involvement, and a push for more evidence-driven decision-making. We're moving in the right direction, and as a youth advocate myself, I think that it's important that we take a coordinated effort to invest in the health of young Nigerians. So the conversation we're having today will be around national responsibility, how Nigeria will finance health sustainably, citizen accountability, how transparency and civil society oversight can protect the public interest, and diplomacy and partnerships, how we align government, private sector, and global actors to unlock new value. So the first question I want to ask to all the panelists here is, how do we shift from donor-recipient relationships to co-investor, co-creator partnerships? We're in this stage where we're trying to shift from dependency to self-sufficiency. Do we immediately go from dependent models to just taking the reins for ourselves, or do we create some sort of partnerships, international partnerships, to see how we can transition into this new age of self-sufficiency? I would like to start from right here, Dr. Uchenna.
Thank you very much. I think the introduction. Sorry, somebody's iPhone is responding to what I was saying. So to make sure we're not speaking to Siri, but to ourselves, I think we've turned it off. So thanks. Maybe it's great to start by thanking CJID, Nigeria Health Watch, and the team for putting this together. I think one interesting thing before I say anything is I felt very excited walking into the room because I don't recognize most of the faces. Because I think for one, in the health sector, I think we suffer from an echo chamber where we keep just talking to ourselves and reiterating what we've said over and over. We're not hearing new questions, we're not hearing new voices. So really excited to be here among advocates, journalists, and speaking. I think the question you ask is very apt, and I think the answer is clear. I think falling off a cliff always ends you up in a crash. So I think it's better to think through what it means to descend from a cliff in an organized and gradual way. I think the answer as well to your question is not a one-size-fits-all. It depends on what you're trying to fix. So we're coming from a place where we've been very donor dependent. Everybody knew when the USG stop work order happened. There was a lot of panic, and that's for a few reasons. And I think those reasons will also touch on the points in terms of what I would recommend. One was when you're delivering health services, commodities are very key. So for some of our programs, we were 100% reliant on the US government. If you're an HIV patient, and in my job at Solina, we support hundreds of sites at the front line that serve HIV patients. You will know there was a lot of fear because those drugs were coming from the US government. Not only were they paying for it, they were also controlling the supply chain for how it got to you, the stores, the distribution. So there was that panic. So I think that's one place we need to address. Of course, you're coming from PVAC, so I'm speaking to the choir in terms of figuring out what it means to gently transition into a place where we have commodity security. We're in charge of the production. A lot of it is done locally, and we're taking charge of our systems. I think the second point that has been spoken about by a lot of the commissioners that spoke will be the human resources for health. We also had a health system where tens of thousands, actually, of our health workers was being paid with donor funding. The issue you have, if you stopped without figuring a good transition plan, is that you're going to have clients at the front line that need maternal health services, HIV, TB, malaria, as the case may be. And even more importantly, beyond just coming to the facility, there's a lot of things that need to happen in the community as well, from a health promotion perspective, finding the diseases and preventing them ahead of time. Immunization services, for example, a lot of which are very donor dependent. So thinking through how to also transition in a phased way, understanding their cost to those things, was also critical. I think beyond that point, I like some of the points you made around the direction of travel being correct. Because I think to be able to do that, you also need to unlock the fiscal space. The government, I think, is headed in the right direction. You mentioned a few. For those that have followed the news, there has been, even this week alone, 2 public hearings from the legislature. One, as you said, on expanding BHEPF to 2%, but another one on taxing sweetened beverages, all of which is increasing government spend. But as we said, government cannot do it alone, right? There should be other things beyond government budgets. The insurance needs to be raised, but also more importantly, we need really to think about how private sector can come in and invest in healthcare as a sector that is not just social, but a sector that drives business. And if I have time, I can say a little bit more to that. Thank you.
Thank you so much. You've raised some very important points around how our workforce has been dependent on donor funding, the fact that we need to own our commodities. So thank you very much. I will go to Dr. Amina to share her thoughts.
Thank you. Can you hear me? Yeah. Thank you very much. So first of all, thanks also to this very important team for inviting me to share my thoughts and the thoughts of my organization, Pathfinder, based on some of the experiences that we've had in the last couple of years. But most importantly, I think this conversation is a conversation that we've been happening since January this year. And I think it was a conversation we should have had 20 years ago. So the party was just ended in January because of the USAID shutdown, or a reduction, marked reduction in resources or aid. And to be honest, as Nigeria, even in Africa, we actually shouldn't have been dependent on aid in the last 20 years because we have actually come of age. So the first thing is, of course, I fully agree with my colleague, Dr. Uchenna, all what he said, but I think I'll come through 2 key areas. One is that, let's look at Nigeria. Nigeria has one of the most vibrant private sector in Africa. We have one of the most vibrant entertainment industry. And we also have one of the most impressive health workers when they go out, not when they're here. What does that mean? It means that, one, we have the human resources, both those in the health sector and beyond, that can actually support and make sure that we have a sovereign health system. And I want to use the word sovereign because that is what will make us independent. He has talked about supply chains and commodities. Without commodities, there's no healthcare. Without health workers, there's no healthcare. But the important thing is that we have opportunities. And one of the things is not only actually the countries in Africa that need to change, it's also us as individuals and organizations. Organizations like us in the development space that are non-governmental, and even the government itself. And I'm happy that the commissioners that are here, and even the Honorable Minister, they understand the challenges and they are willing to make changes. Over time, we have not been looking at impact. We have not been looking at results. We have just been putting money because the money did not come from us. Maybe, I'm not saying that is really categorical. But you see, the amount of resources that has been invested through aid in the last 20 years did not get us the results that we need to see. So we didn't see value for money. So maybe this is even an opportunity. It's actually a silver lining in my view. And that from January till date, the kind of innovations I've seen in Africa, because at least in the last 2-3 months, I've been in Senegal, Kenya, Cote d'Ivoire, and others, and I have seen interesting innovations. And these innovations start from the community, women and young people. You see, technology is really creating a huge, huge opportunity for our young people who know how to use it best to be able to address a lot of things. One is even the commodities and facility access itself. You see that, for instance, young people and when you work with the private sector as well with young people, a lot of initiatives are coming up where access to healthcare doesn't have to be people going there themselves, So utilizing those kind of technologies. AI is one important one. So I feel for me, this is the right time where Nigeria needed to even have this challenge so that we can think beyond the general or normal or mundane ways of doing things and look at what we have as a country to make changes. But another very important issue is women themselves. So we at Pathfinder, last month we launched what we call Women and Co. Why did we do that? Women and Co means the whole community is involved in the issues of women. And we realized that we're not talking about just women going to health sector to get, services. No. The issues about women start when they are very young. And all the education here, someone talked about the social determinants of health. Because healthcare is so important that every other thing affects healthcare, including security, education, infrastructure, climate change, and all. In my view, one of the things that we need to do as a nation is to have each ministry earmark at least 1% of their funds or revenue or budget for the health sector. That is another important way that we can be able to get additional revenue for the health sector. But that is not enough. We in the health sector also have to make sure that we utilize those funds judiciously because trust is an issue. And most often our communities do not trust our health system. And we need to change that. So one is getting more money. We can do it at the local level in each of the states. If each 1% from all the ministries, some have up to 20 ministries in a state. So this is a suggestion. If we can get that, we put it in a trust fund and the community is able to manage it and hold the governments accountable. Everybody needs to be involved in this and everyone has a role to play in ensuring that the financing that we have lost, we are going to gain it within us, domestically, generate it in innovative ways because the money is there, but we are not putting it in the right place. Thank you.
Thank you so much. Definitely. I think the core of what you're saying is necessity is the mother of invention. As drastic as these funding cuts have been, it has forced us to really do the work to think creatively around how to create what you said, a sovereign health system, which is very significant for our own health security. So I want to go to Dr. Charles to speak on the initial question that I've asked to the whole panel here around this transition from dependency to self-sufficiency, and any thoughts you have on that.
Okay, thank you. Let me appreciate the organizers of this program. very interactive, very nice, excellent one. And greetings from my Honorable Commissioner, Dr. Banji Filani. Well, I left the hospital setup to a program in 2010. That was from hospital setup to HIV program of my state in 2010. And the first partner I received in my office was FHI 360. And the major topic that time was sustainability. 2010, 2025, we are still on sustainability. So that is number one. Number two, Nigeria have to sit tight this time around. We've spoken a lot of grammar, documents upon documents, and a lot of other things program, just for us to sustain our programs. But always we have documents, we have documents, memorandum, but no actions. So this is the time for action, because it is cutting us below the belt. There are three major sources of financing health. Number one, government. It could be federal, it could be state, it could be local government. The second one is through partner, and the third one is out-of-pocket expenses. Out-of-pocket expenses accounted for about 70%, if not more. And partners. But for the government has been dragging foot on the 2001 declaration, Abuja declaration, that is 50% of budgetary allocation should go to health. With the data we have here, it has been less than 5% since that time to this present moment. In many states, it's the same thing. My state was able to get 11% in 2024, but in 2025, we could not get to that. Please, off record. I'll see her so that to save my job. So, and that is how it is. So we need to focus on that. The government has to rise to the responsibility. However, there are a lot of things impeding that. There's no way you will have a very beautiful health center without an access route. So it's a challenge. There's no way you will have good health center, good access route, but no water or no electricity. So most of these problem challenges boils on a lot of reasons. But all the same, it is very important that we have to do that. Now, out-of-pocket expenses, that is what we are trying to reduce now, drastically. And all the states of the Federation are on deck to do that. Health insurance uptake has been increasing from about 2% some years ago to presently 10%. However, people are still very not happy about the 10%. To them, it's very small. But if you know the energy, the input of the states to this, you will appreciate them. In the past 2 years, the way health insurance uptake have increased is very astronomical, and we are still on it. Every day, every night, we are still working to making sure that many people are enrolled in health insurance. And health insurance too, because of many aspects, like the government, we are trying to form synergy with the federal government. The state are trying to form synergy with the federal government through the Basic Health Provision Fund. If some of us could know what we have in Basic Health Provision Fund, we appreciate government. Now, with Basic Health Provision Fund, a lot of treatment could be, a lot of diseases could be treated. It has even been expanded to other things like CMOC. That is CMOC, that's what we call CMOC. That one takes care of pregnant women, where pregnant women can access free operation and some other emergencies treatment. So, but all the same, the health insurance is still the major solution to this problem. And also the government must increase the input from less than 5% to, it should be increased, systematically so that we can achieve the 15% Abuja declaration. When we have more money, we can do more. And there have to be sincerity, there have to be transparency. Now we are trying to do everything in a transparent way. Even the fundings we have, the donor fundings we have, I've not seen 60% transparency. Donors, that is donation where we will have about 65% going into logistics and less than 40% going into the real operation. So that has to be corrected too. And Nigeria is ripe enough to not to take any assistance when it comes to health. Because when we go out, Nigerians excel in health sector. So if we can excel in health sector, we should be able to excel in our own case too. Thank you.
Thank you so much, Dr. Charles. And specifically what you're saying about how intentional are we about allocating money to the right things? That's very important when we're looking at how to get out of this state of dependency and into self-sufficiency. Now, I will go to Dr. Biobele. Oh, I hope I'm pronouncing your name correctly. Sorry? Biobele.
Yes.
So I want you to answer the same question, but I'm particularly interested in data. So some of the work that you've been doing at Budget has to do with tracking health budgets across states, federal level, DMAs, MDAs around Nigeria. So what are you also seeing about the data that shows our readiness for transitioning to self-sufficiency?
Okay. Hi, everyone. Good evening. So I'm going to just start by saying a big thank you. But it's also a privilege to actually be seated here and having to share these thoughts. So I come from the last mile. I'm the one who interfaces, who brings the voices of accountability from the community level itself. So basically, I'll just give a preamble before I actually go into the data part of it. A lot of times decisions are made, but the people who actually receive the decision, who actually receive the impact from the decisions are not on the table most times. And a lot of times when we look at the community itself, how much of community inclusion, participation, and accountability are we also building in the system itself? Now, a lot of times we're looking at how much of, we're in a transitional era right now, and there's a lot of movement from donor funding, but some of the work I have done in the last 2 years have seen community members own up the system. They've done a lot of work. We've seen corporate social responsibilities, community members beginning to say, look, in as much as we had this belief that the primary healthcare or the healthcare system belongs to the government, we are the owners of this system. And the thing is, a lot of them want to be included in the system. A lot of them want to be able to leverage on philanthropic donations. A lot of them want to look at the private sectors, like most of the other speakers have mentioned. A lot of them also want to look at how they could also raise resources for themselves. But some of the findings, I was penning down my thought as we're going on. Some of the findings that we also had was that there was a poor feedback system. A lot of services were being rendered, a lot of metrics were being, indicators were being monitored, but what was the feedback from the people who are at the last mile? Now, the findings that we were doing, and when we looked at using digital tools like the PHC tracker, using other tools, leveraging on some of the government data dashboards to also engage, it was quite interesting that we looked at we're still below Abuja declaration for 15%, one. And in as much as most of what we've seen over the course of the years or since January, we now found out that there's a lot of dependency for some specific products or programs on donor fundings. The other part is that there's a large variance in state performance, and I think in 2024 budget, we saw just 8 states were able to utilize majority of their budget itself. So there's this thing we usually do in one of our engagements was healthy competition. So we now begin to, instead of looking at what is not working, what has worked? Can we replicate that same thing? So we look out for states that have done exceptionally well in their health budget, and we begin to amplify their work. Let everybody else come to the table. Tell us, how did you do it? Tell us what failed. And a lot of time, I said this earlier today, I said a lot of time we sit in meetings like this and we want to discuss what is working. Can we also sit down and discuss what didn't work? So that at the end of the day, we'll also learn from that. The third part we're also looking at is we need to strengthen the budget credibility process, and there's no way we'll strengthen that process. Like Dr. Charles had said, a lot of transparency and accountability have to come into play. And then lastly, we're also looking at how do we also leverage on tracking tools. Dr. Amina was speaking earlier, and she was talking about digitalization, and the world is fast moving. We are going off, sorry, I'm still old school with my pen and paper, but we've started moving to the digital age. There's a lot of, see, Dr. Uche has his digital pen and paper. Me, I still have my Bible and my book. But there's a lot of digital technology that we could leverage on to be able to look at this data. One key thing with data is, it looks like numbers to you, but those translates to people in real cells. And then the other thing with data is beautiful, because if you have the right data, you could actually do a trend analysis to see what's working. You could see where the focus is. Dr. Charles was talking about the utilization of NHIS and all of that, and you say from 2 to 10%, It's small, but you know how many lives are in that 8 margin gap that has come in? And those margin gaps are people who may not have been able to access those services out of pocket because of the things that are happening not just in Nigeria, but the things that are also happening globally. So one key thing that we also need to do in the course of what we're doing, and as Dr. Uche had said earlier, seeing new faces is also trust building. There has to be a lot of awareness. People need to realize that the health system is not only for the government. And I remember one time when we had a table conversation and we said, this is not the time to look for what is not working. This is time to say, how do we all come together and build a robust system that is credible, that is accountable, and that is resilient itself. A system that can also look internally to solve its own context-related problems. So thank you, that's it from me.
Thank you so much. I love the passion with which you speak. And you know, you highlighted something very clear that, you know, without the numbers, we're basically working blind. And so it's very important for us to learn from the data we're able to collect, not just criticize, but actually compound on information. And so in the interest of time, I want to see if there's anybody from the audience, if there are any questions in the audience, so we can take them. I think you have one over there. And one over there. I think those will be our two. Is there a microphone that's passed around?
Hi, good afternoon.
That's fine. You can go ahead. If you can.
One of the things I would say about this finance thing that I would like to ask is, how do we let people understand how to prioritize their health, whereby health isn't looked at as something low on the scale? I don't know how to explain this, but one thing about Nigerians is we have this kind of, whenever we get sick, that's when we know there is something wrong. But most times the sickness has been there since. So most times we spend more when we could have been prevented. Some certain people just feel, oh, it was there, it was not there. So whenever we look at finance, it's not just only about generating money. It's also learning how to work with what you have so you don't have to spend more than you have to. So how do we let Nigerians understand that the health that they have should be prioritized, not just when it goes bad, but how to preventive healthcare, exactly, something like that.
Thank you. I think we'll also just take the second question as well before we tell everyone to answer.
Thank you very much, and thank you, Dr. Amina, Dr. Uche, all the doctors in the house. Thank you so very much. I'm glad that we have commissioners in the house, and my question is straight up. How can we ensure that community owns this thing? They have to own it, and we don't have to go to them to create this unnecessary awareness that we're doing that is not getting to them. I'm happy the Commissioner of Jigawa is here. There were some shocking things he said in Calabar that I don't want to mention here. Thank God that we're working towards a situation where a 14-year-old girl or guy can walk into any facility to do tests for HIV, to do tests for, and own it, that their parents don't even have to restrict them or go to any facility to just get commodities and take. Again, transparency, accountability is all we say all around here. So how can the community own these things so that we'll be hearing from them and we'll know who to hold accountable than for us going to tell them, do you know it's important for you to test? Let the person in my community be telling me, do you know you have to test? Or I went to this facility and the healthcare delivery people or persons are not helping matters. So I think we've gotten to that point where communities need to own these things and for them to start fighting for themselves. Thank you.
Thank you. So I think we have two questions that are kind of in a similar vein.
Yes.
One on how do we teach people to prioritize their health, and then how do we teach or ensure that communities own their health and the results. So I think we'll reverse our order this time and start from the end and come this way.
All right, thank you very much. Bola, thank you for that. For us to look at prioritization of health, we need to ask ourselves the right question itself. How much value do we place on a system? Because as much as you mentioned, a lot of people are just moving vehicles without realizing that they have issues. And there's this thing, it's a culture, it's a multi-sectoral thing. If I don't know, it doesn't affect me, it doesn't kill me. What I don't know will not kill me. And you know, those slogans somehow have been ingrained in our heads to say, I can manage it. My body is strong, I'm young. And one time when I was looking at some of the feedbacks from the portal, and I was communicating with some of the community members, so I asked them, how many of you people utilize the primary health care? So I went out of the extreme and I asked the extreme. So I asked the elderly and I asked the very young persons, because the people that you normally see utilize the primary health care, coming to that context itself, are pregnant women and children. So I asked the elderly men, I said, do you go to the hospital? They said to go and do what? It's only antenatal they do. So it also makes you realize that some of the community members themselves do not know services that are offered in their PHCs themselves. And sometimes also, it's also sad that sometimes when they have out of stock for some certain commodities, people go the first time, they go the second time, they just assume that they don't offer those services there. And even if I don't offer specific services in my PHC, I could also refer you to where it's being offered. Now the other thing, we also asked the young people, okay, so why don't you use the primary health care itself? And then they started telling us a lot of stories. But one key thing that also stood out was also the perception to the behaviors of the health workers. So that's also something that we also needed to address. So how do we also prioritize health? One, there's no way, Rachel, unfortunately, we are in a state where, I'll use the COVID example. We all know that before you eat, you should wash your hands. But do you know how many people struggle to wash their hands during COVID? Children actually were able to adhere to that information very fast because what? My teacher said I should wash my hand. But a lot of adults you see just put their hands and eat. So when it comes to health and the ownership in health, we still need to go back to the drawing board to say, how do we have health awareness? How do we have promotion? But they're not doing it the conventional way that we usually do it. It's easy to have a young person talk to a young person. They can relate in that context. It's easy to have a woman talk to a woman. It's easy to have a man talk to a man. How do we now raise champions that are not based on material or, there's a word for it, transactional exchange? Because a lot of times we raise champions in the community and there are incentives. Once those incentives are taken away, everybody goes back to the status quo. It's not my business, it doesn't affect me. But the thing is, how do we raise champions that understand, that are able to advocate? So I'll give you a typical example on a nutritional program that we had some years back, somewhere I was working. And there was this woman who had a mental challenge in one of the facilities. And she came in with her child because somebody had told her that if she goes to that facility, they are going to give her 10,000 naira. And she was excited. She brought her baby. And so when she came inside, she had a tussle with the nurse. Because she said, give me my 10,000. The nurse is looking at her. And because she also had some form of mental challenge at that point, a lot of patients were segregating against her. So I walked up to her and I said, Mama so what's the problem? And I heard somebody translating for me. And she said, they promised me 10,000 if I bring my baby to the hospital. I said, who did that? Now, because they were trying to raise a lot of awareness at the community, they began to give false promises that were not realistic. Now, at that point in time, I said, okay, we cannot afford 10,000, but what can I give you? Then she said she liked that soap, that one that is there. So I had to go into the room and I said, give her a bar soap. And she had a very nice time because this was a very remote location. And then her baby was treated for severe acute malnutrition and they left. And then, do you know that lady became a champion? She would tell the patients to go to that facility, tell Dr. Deviana that I'm the one that told you to come. So everybody that came to that facility requested a bar soap too. but the point is, once you have one community member, it doesn't have to be a very vocal person. Somebody that is respected, somebody that understands. Once you have that buy-in, there's that ripple effect. For me, those 10 children that lady brought to me was way more than going to do a mass campaign and doing all of that, because she was able to initiate a start process. And then lastly, community inclusion is the only gateway for accountability itself. Just a small point on that. So during one of our engagements we were having, some community members had come together to install a solar at a facility. And then there was a handover that wasn't done properly. So the in-charge at that facility had received the instruments and everything. And at that point in time, I came all the way for Kaduna, let me talk. But sorry, that's a joke. But the in-charge at that time had taken over the facility, and she kept saying, you know, I came to the facility, this, and she was saying a lot of this. So a community member put their hands up, and I said, what? And I said, yes. And the person said, Madam, the solar, the 2 fridge in your facility, and the equipments in your facility, is we, the community member, that brought it to that facility. So you see, that's another tier of stopping a lot of misuse, a lot of theft at the facility, and also a lot of mismanagement. Because when the community members see and they are involved, there's also that protective structure that comes with it. So community participation, inclusion, and decision making is the one way we can have the community own the health system. Thank you.
Thank you so much. Thank you. Dr. Charles.
Thank you. I will use the same answer to answer the 2 questions. How do we prioritize health, and what's about community ownership? You know, we need to look at our structure. Most of these problems are structural. When I was in primary school, I attended public primary school, and that time we used to do health education as primary school pupil. That is when they will teach us basic things, how to stop blood, if someone is bleeding, nose bleeding, you know, wash your hand, all those things. Those things are no more there now. So if those things could be restored, there will be a lot of improvement. And now we even have more things to deal with, you know. That time we talk of malaria, how do you prevent malaria? You clear your drainages, you don't allow bushes, you know, things like that. And they are still with us now. So we need to go back to that. And maybe even improve on it, like how to cross road. You know, some people, you still see some people facing or backing incoming vehicles. It's a net issue. So we need to go back to primary school, we need to go back to our educational system and do that. And also, there are many ways we can improve on that. And that is where we have the community buy-in now. In primary health cares, we have the people we call health educators. They do go out and they work a lot. So we just need to encourage them more. We are doing a program in Ekiti State whereby we pay free treatment for pregnant women, under 5, free immunization, free family planning, and malaria treatments for everybody. And there was a time our commissioner was looking at it at the dashboard and discovered one particular health center has a lot of patients, and he called me. Second day, I moved to the health center. I got to that health center around 3:45. And I still met about 21 patients there at that particular time. So I called one of the patients. Why are you just coming? How do you know about this program? He said, a sister nurse came to our street to tell all of us, and we are here now. That is the work of health educators. So the same nurse will tell them how to take care of their health. The same person will tell them to come to the hospital if they have a problem. So someone like that too will also be used for several things. So we need to promote it. So I'm really appreciating primary health care for a lot of innovation nowadays. We need to look at our religious leaders too. You know, a religious leader can command as many millions as possible. People like that should come into health, not always talking about tithes, talking about offering, talking about giving to God. Please don't let us. If you want to know more about that, I have a book from crusade to conglomerate. Check my name on Amazon, you'll get the books there. So, and the most important of all, depressed men and women. They need to help us a lot. Because when we are looking at health workers to do most of those things, they are overwhelmed already. I can believe most of these commissioners here today will tell you what they are facing to get little staff they have in their hospitals. So now we have even developed a lot of tactics. Now we have task shifting, task sharing, task this, task that. You see a nurse doing 1 or 2 things, administrative work. So they are overwhelmed. So sometimes when the recent research on attitude of the health worker was not really favorable, very poor. But when you go to that place, you will know what they are facing. That is not an excuse not to behave very well, but actually they are facing a lot. So the community needs to come together and assist in making sure that all of us are aware of our health and how to go about it. Thank you.
Thank you very much. And I'll go to Dr. Amina next. In the interest of time, please keep your comments to about 1 minute each.
All right,
Thank
I
you.
will. The good thing is that they've already said almost everything that is in my mind. I totally agree that for us, to be able to ensure health is prioritized from childhood, we need to start even from the schools. And my, co-panelists have said that at the primary school level, secondary care level, and all. But another thing is that I think the problem is that because health is a very technical area, we try to over-medicalize it. Health is different, medical is different. And health is the state of, complete well-being, mental, physical, and, social well-being, and even emotional well-being. So I think what we need to do, and the media is very critical here, is to see how we can ensure that every individual understands the importance of preventive medicine, the importance of the lifestyle even, in order to be able to not even get to a place where you have to need very serious treatment in the health facility. Most of our diseases in Africa are actually related to lifestyle, either what we eat, our sedentary ways of working, and so many things. And that way, if we understand public health, I think for me, public health is so important that it's not supposed to be only for health workers. All of us here should be public health specialists. It is our business. One last thing that I want to say, because as I said, they've already said everything about the media, the religious leaders and all. There's a lot of rumors and myths and misconceptions about health, and I don't know why. Maybe because it's not as interesting or entertaining as it should be, or because people don't genuinely understand health itself. So we have to make health as basic as possible. And I will actually recommend one of our partners, Aproko Doctor. Aproko Doctor is an example of somebody that is making health information very basic. Please, in all our own ways, let's try to do that, because if we do not, people will go and learn about health in places that they shouldn't learn from, maybe traditional healers and all that. And because there's this kind of, in health, there's also that emotions around health. As she mentioned, the attitude of our health workers is very important. If I go to the healthcare facility and it's not even, Dr. Wada said it earlier, it's not somewhere that I want even my dog to be. And then the experience with the health workers is also very negative. I will not go back there again. I'll go and start looking for healthcare somewhere else. So I think for me, media, and then women. Lastly, we women, we have to even decide that it's a state of emergency for women's health in this country. It is actually a state of emergency. It is not fair for any woman to go to give birth and die of preventable diseases. And enough is enough. And we have to take our health by ourselves, form coalitions, and say we will not accept. Every death should be accounted for. The maternal and perinatal death surveillance and response has to be in place. And that will not be only for women's health, it should be also for every death that occurs. No person needs to die of preventable care in this country. Thank you so much.
Thank you so much. And just some final thoughts from Dr. Uchenna.
Yeah, thanks. Everything's been said. But I think I'll bring it together. In one, they've said clearly we need to demystify health, make it simple. Two, we need to create millions of champions. Just counting the health workers and the health education is not enough. Three, we need to be able to pass that message in a very low-cost way. By that I mean the champion needs to be across the room. The times of sending people to far-reaching communities to go and do it, that's not an efficient way. And there's a specific program called the Community Women's Reorientation Network, which is championed by the Aliko Dangote Foundation, but with support from Solina, that mirrors this initiative very well. So it takes the polio workers. So for the polio eradication program, tens of thousands of young women who typically would deliver the drops house to house have been working on the program for many years. So you find them in almost every community in every ward. So taking those girls, first of all, they are young, so they can speak to other people. They are also growing to be the mothers from tomorrow, right? putting them in groups or cooperatives that is incentivized with economic empowerment activities, and then teaching them on how to pass the messages, almost making them like mini health workers within all their communities. Then helps to be able to propagate these messages. I think scaling these sorts of interventions will really help as well. Thank you.
Thank you so much for wrapping us up so beautifully. So I want to thank all the panelists for your time, and thank you to the audience for your attention. I think we'll transition to the next phase. Thank you again.